Hi everybody, welcome to this video on the preventive mobility routine from Eat, Move, Thrive 30, the book out now. So this preventive mobility routine is actually from the Functional Range Systems system by Dr. Andrea Spina. So it's within the functional range conditioning. I have approval from him to include it in the book for you guys because I think it is the most important, most effective way for you to prevent your restrictions in mobility and improve them on a day-to-day basis. So what we use in this preventive mobility routine is the controlled articular rotations. Controlled articular rotations are basically joint circles done to the outer limits of range with tension and control. And each time you do those, you are uploading information to your brain and giving feedback, telling your body how healthy your joint is or how unhealthy, what you need to work on, right? Every time you upload good information, it reinforces the good movement, the good information. It down-regulates pain, inflammation, and restriction and starts to improve that mobility day to day. So why do these CARs? Well, I always tell people, for joint health and longevity, a lot of people think that's a little bit boring. For injury mitigation, that gets a lot of people, so you can prevent occurrence because you can find restrictions where they are, you can improve them, and you can prevent injury. For rehab and training, and for allowing to reduce stiffness, pain, inflammation in your joints, as well as, like we said, some articular screening. These CARs, controlled articular rotations, simple rotations of your joints to their outer limits, will give you an effective way to teach your brain about your body and teach how it is in real time. You do them every day, like you brush your teeth. We brush our spine, we brush our joints, we move them every day so we know how they're working and how they're functioning. Right. So, procedure, how we do this. It's a simple procedure. Say I was doing my wrist. What you do is you take a breath in, trap the air in your lower abdomen, so we're just going to radiate and tense our body. I'm going to just do my wrist. So I want a little bit of contraction, a little bit of tension in my whole body so that the only joint moving is my wrist. So I trap that air in that lower abdomen, I irradiate, then I'm going to rotate that joint. So now I'm going to go to the end ranges of motion all the way with slow, controlled motion, 20-30% tension here. And we go one way, then we reverse and do the opposite way. You will work the joint and the attaching muscles, ligaments, tendons, different when you go each way. So, breathe, trap the air in your lower abdomen, irradiate, rotate the joint one way, rotate joint other way, and repeat. It's simple as that. So now I'm going to take you through the preventive mobility routine. We do our neck, our spine, our shoulders, our shoulder blades, our elbows, wrists, hips, knees, ankles, toes, and another extra spine cat-camel because we cannot get enough spine movement in our day-to-day society. So I'm going to take you through that. We're going to do one rotation one way, one rotation the other way. Follow along and try and just do them as best you can. They will improve over your 30 days. They will get better. So just try them and try and go to where you can. Watch out for pinch points. Pinch point. If I'm on a closing angle and it's pinching here, we want to avoid pinch points. So don't jam into that. You can go up to where it is and work through so you're working that pinch point. If it's quite sharp, stop. Listen to your body. If there is stretch or tension on the opposite side or the opening side, that's good. All in. If it's a sharp pain anywhere, we need to watch out for that. But look out for those closing angle joint points. So where here, that's a closing angle. We want to either skip that range, or we want to slowly just work up to that range with what we can. Okay? Listen to your body. Otherwise, let's go ahead. So we're going to take a breath in, trap the air in our lower abdomen. I like to create two fists or cross my arms to do my neck. I'm going to tuck my chin, Rotate that chin to the left. Drop the ear to the shoulder. Head goes back. Extending all the way, slow, controlled. We're thinking about 1 mile. Tuck the chin and back around. Reversing that. Coming up. Tuck the chin. Rotate to the right. Drop the ear. Slowly back, extending over to the other side. Don't let the shoulders hike. And around. That's your neck done. Upper back. We're going to be having a nice wide stance. We're going to curl like a crunch. Rotate our spine. Drop the left shoulder. Coming back. Arching over, squeeze the bum. Don't let your hips sway. Over to the right side. Shoulder down. Elbow down to the hip. Coming around to the front and up. We're going to reverse that. We're going to curl down. Rotating to the right. Drop the shoulder. Extend, arch through, going to what range you have. Good. Drop the left shoulder down to the hip and rotate back around and up. Perfect. Into our shoulders. I'm going to go on my knees. You can do this standing on your knees, whatever's comfortable for you. I'm going to pop down. We're going to again take a breath, trap the air in our lower abdomen. My right arm is coming up. And I'm coming across and then lifting up to what my end range of flexion is. When I hit that block, look at that thumb. Rotate it outwards. Reach it back. Reach, 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 reach. Trying to make the biggest circle you can as your shoulder rotates in the socket. The back of your hand ends on the side of your leg. We reverse that. Extend, going all the way back. Around, coming back to our flexion point, and then back down, palm up towards the ceiling. We're going to do the other side. Same thing. Take a breath, trap the air in, arm comes across, palm up toward the ceiling, reach to your end range of flexion. That thumb rotates outwards and reaches as the shoulder rotates in the socket. Around, slow, controlled. Remember, slow. Extend, coming back, around, all the way up, and around, and down. We're going to do our scapulas. So scapula, or shoulder blades, I like to go straight out, then to 30 degrees. What I want you to do is then I want you to pull them back, lift them up, reach them forward, drop them down. Reverse that. Up. Pull them back, drop them down, reach them forward. That's all that is. Elbows, hands pinned to your side. We're going to be lifting or flexing, so palms up, bend your elbows all the way to their end range. Slowly rotate the thumbs inward, reaching towards each other, and reverse that out. Coming down, back of the hands as you flex up. Rotate the fingers out and straighten. Good. Doing our wrists. We're going into our wrist. I like to do one at a time because I find the wrist very hard. We're going to be extending. Going to go inwards, coming up. Try to keep those fingers straight if you can. It's just your body's way of cheating when they curl. And reverse. So we're coming out. You have much less rotation out than you have in. Rotating down and extending. Remember, go slow. Feel your body. Feel your end range. Going fast will not get you anywhere. Doing the left wrist, straightening down, coming in, slow, controlled. Pay attention. If you need to, close your eyes and have your eyes pay attention to your wrist. Great. We're going to do our hips and our knees now. So with our hips, we're going to use some kind of wall or surface, and we're going to be lifting up and doing a single leg hip car. So I'm going to lift this left leg. So my right leg stance leg is tight. It's irradiate. Take a breath in, trap the air, irradiate. I'm going to then lift, and I want that foot coming up high. This is our external rotation. Then we're going to come out to what our limit is, rotate. Stay high then go down the ski slope, coming around and through. We're going to reverse that. Foot goes back. We're going to open and pull up towards the armpit, coming around. As you reach here, bring that foot high to get the end range of your external rotation and abduction. Same thing on the other side. Radiate, tense, trap the air in the lower abdomen. We're going to lift up. We're coming out. As we reach there, lift. Don't let your hips go. Engage your core. Down the ski slope. Coming around. And reverse. Going all the way up. And around. And down. And I'm going to just show you one more from the front so you have all the views. So we're going to take a breath in. We're going to trap that air. We're going to lift up. Keep the toe high. Coming out. Lift, rotate down the ski slope. Good. And reverse. Foot goes back slow. Open. Pull up towards your armpit. And foot comes through and down. Onto our knees. Knees I like to do seated. So we're going to come in here. We're going to be seated. If you have a good flexibility in your hamstring, you can pull that right in. If not, do a nice relax there. We're going to turn our foot up, toes towards you. Then what we're going to do, we're looking for rotation at the knee. Straightening your knee, rotate in, bend your knee into its end range, rotate. So we're going to reverse that, rotate out, inwards, straightening, rotate out, and bend in. Other side, we're going to be rotating, straightening, rotate in, bending in, rotate. We're going to reverse. Rotate in, straighten, rotate out, coming in. Down to our ankles. Trying to draw the biggest, slowest circle all the way up, all the way out. Point the toes and reverse. Pointing the toes, coming out, all the way in, going down and through. Doing my right one, point and scour, so we can go into the ground here and we can scour the ground to our end range, toes up, rotating in and reaching. We're going to reverse that all the way out and down. With our toes, what I want you guys to do is I want you to try and lift those big toes up without lifting the other toes. If you struggle to that, use your hands, pop them down. Lift the big toes up, keep the other toes down. Drop the big toes down. Try and lift the little toes up, but keep the big toe down. Drop them down. Lift the little toes, keep the big toe down and down. If you can't do this, you just hold down those big toes, try and lift them up. We're going to lift all of them up and slowly try and lower one by one, by one, by one, down to the big toe. Lift them all up. Slowly lower one by one, by one, by one. And our last one we're going to do is the cat camel spine cars. You would have done this in Pilates and yoga, etc. It is simple. It is a cat and a camel, but we're trying to do segment by segment all the way up. We're going to tuck our pelvis slowly under, and then everything slowly follows till our head follows last. Keep that head down, untuck from the base as the rest of the spine follows suit. One more rep. Tuck that pelvis under all the way, segment by segment, maintaining your cars tension. Untuck. Deliberate untucking of the lower spine all the way. Perfect. That is your preventive mobility cars routine from Eat, Move, Thrive 30. Remember, sequence is take a breath in, trap the air in your lower abdomen, tense and irradiate your body, and move the joint with tension and control to the outer limits of its range and reverse that motion. Each one time one way, one time the other way, every single day. Brush your joints, use it for screening, Use it for knowing your body well, for joint health and longevity. You get blood flow and nutrition into your joints by movement. Okay? We'll see you again soon.